Hello again. The South African Medical Association is questioning the value of Cuban doctors brought to South Africa to help fight the coronavirus. The doctors were hailed for having experience in community service, and hundreds of millions of rands have been spent on the ground. To look at whether they've been serving their purpose, we're joined now by Dr. Mvuyisi Mzukwa, SAMA Vice Chairperson. A very good afternoon, Dr. Mzukwa, and thank you very much for joining us. So according to reports, we've spent a total of 239 million rand on these doctors. Was it all worth it?
Good afternoon, Dudu, and all the viewers of ENCA. As you know, we had said stuff or even complained to a certain extent that there were South African doctors were left behind and were not employed. It was until we made that noise that we were approached by the Department of Health to provide a list of unemployed doctors in our country. Having said that, we had also challenges at that time that we thought should be brought to the attention of the public, as it is the case even now. The fact that those colleagues from Cuba needed time to be, orientated around the country and stuff like that, familiarize themselves with the environment. But also, the second challenge is the challenge of the English language. They had problems, challenges with, expressing themselves. Most of them actually didn't know how to express themselves in English. Not that English is the best language, but I mean, we expect at least people to be able to communicate with other people from other countries, whatever the case may be. But in the case of South Africa, we needed to have a person who's going to be able to do that with our communities. But on top of that, our own colleagues, those that were made to work with the colleagues from Cuba, they were then asked to write a report on their competency, which we found it very difficult. How do you say stuff about your own colleague in terms of their competency, when you know that it might not be competency, but it might be challenges, barriers, as I've outlined in the first place, that there were issues of language and all those things. In that case, we do not feel that it was worth it to be bringing up those colleagues from abroad and put them in that muddy water in our country.
So essentially you're saying this was not worth it. What was the alternative at the time?
I think we have expressed it even in the first place. I mean, we have our own colleagues, whether they are be around in government or whether they are in the private sector, who have similar qualifications. Let me make one example. We've got Prof. Slim, who is actually our own South African, who works with government, and there are many of them who are having, respected expertise like himself, who are supposed to be, given a space to assist with, government in all, approaching this pandemic. Even in Africa, for example, we've got competent people who are going to be, of assistance, to assist our country. Because we must remember, Africa is experienced in terms of dealing with epidemics and like Ebola and stuff like that. So there was competence even within Africa, but we found ourselves getting Cuban colleagues. And we even said in the first place, we do not have a problem with our colleagues coming in, and we don't have problems with them, but we have problems with, how they are going to be delivering on the expectations of government and the South Africans, because they don't have what it takes at this point in time to be assisting our country, because there are these barriers that they come up in with.
In April, the term comes to an end of these Cuban doctors. Should provinces request extensions, or what would your view be? Should provinces actually say, well, we'd like them to still stay on board? We see their value.
Well, I think the government needs to account and obviously come to the, make a presentation to say why should we pay more for the Cuban doctors. They need to audit themselves. They need to come up with that report, ensuring that we really had to pay that money. I think you and the rest of the media houses need to ask these difficult questions so that the public is made aware whether it was a waste of time or not. But the reality is that there is still a shortage of doctors, even in the presence of the Cuban doctors. So the challenge is whether they are effective or not. I think a report will assist in that regard.
Mvuyisi Mzukwa is the South African Medical Association Vice Chairperson. Thank you for your time.